Last week we discussed fibroids and the medical intervention when it comes to fibroids, the do's, don'ts, how doctors or medical practitioners handle or manage fibroids when it gets to their side of the conversation. This morning we want to now talk about cesarean section.
Today we're talking about fibroids and the complications that thereof, right? So when you have a fibroid, we say it's non-cancerous, right? So the only time you require an intervention is
that the same as benign? They say benign.
Yes. So it's benign. So the only time it becomes for us to come into it, for us to intervene in the fibroid, in the sense that you're having prolonged bleeding. Okay. The fibroid is causing prolonged bleeding, it's causing constipation, it's causing frequent urination, it's causing swelling or enlargement of the abdomen.
And I'm sorry to ask,
backaches or leg pain.
And fibroids, what's the relation or what's the difference?
So, how do I say this without... The word cyst is from like a capsule. It's encapsulated. It's descriptive. It's like a capsule around it. Whereas it can be a cell that is growing abnormally. So that one, you could cut into it and you have blood vessels into it.
Oh. Yeah, so
that's what's causing the...
That's what's causing. So they sit on blood vessels. They sit on pathways because that's what they need. Yeah, that's what they require to.
The fibroids.
That's what's the fibroids. That's what I said.
The fibroids do that.
Okay.
But that's what causes the bleeding.
That's causing the bleeding. That's what sometimes can even stop your menses from coming.
Because all the blood is going into...
Right. So that's what they believe. We believe that if you are pregnant or you have a child, it's because the child is taking on all that is going to reduce the size of the fibroid. The hormones level is going to go down. Yeah. Right. But the problem too is having fibroid when there's pregnancy is also there. Wow. Two things that occupying the same space.
So I'm sorry, I didn't get the cyst. I didn't get the cyst bit, sorry.
Yeah, so women have gone and done scans and someone will come and say, I have a cyst. Mm-hmm. This topic, I think if we want to talk about it, I don't want to brush on it and then because most diagnosis is cyst. And then later I found out that it's fibroid, right? So I don't know.
It starts as a cyst.
Cysts are not exclusive to women.
Yes.
That's
and
okay.
Cysts can be spread wherever in the body. It can be found anywhere.
So the cyst is like the membrane filled with pus or whatever is inside.
Yeah, it can be filled with fluid, it can be filled with blood, it can be filled with...
And just to be clear, since we're passing over, one doesn't lead to the other. These are two different things. Yes. They have no correlation, so to speak. Okay.
But he says that sometimes they can find it as a cyst, and then sometimes they can find it as a cyst, and then they'll later diagnose it as a fibroid.
Yeah, another thing we should also know that cysts can form... When we talk about cysts, it forms everywhere. It can form anywhere in the body. It can be pus filled, it can be fluid filled, your back, it can form anywhere, right? Yeah. Whereas fibroids, we are looking at it that its attachment is to your uterus. That's why you have. Last time we talked about types. There's one that is pedunculated fibroid. It's attached itself outside the uterus by like a projection, like a stalk that's holding onto it, that's hanging off it. There's ones that are formed in the tissue lining of the uterus. Yeah. Wow. Right. So if it's outside. Right, if when it's outside pedunculated, sometimes you can feel it if you do a physical exam of the abdomen, the person is lying down, you can feel the pedunculated fibroid.
Wow,
that's scary.
Yeah, but those ones because it's outside, we don't really matter. We don't mind. Yeah, it's outside. Yes, because so you can even still get pregnant.
My mind, I was like, once it's come outside, that means
it's like outside the uterus.
Bro, nothing outside is everything outside is safe.
If the fibroid is not causing any complications, such as I talked about bleeding, frequent urination, constipation, we don't have a reason to go in for intervention. We don't go in. Second thing we also look at is, have you had children? Are you done with childbirth? That's also a factor. Right? It will also determine what kind of procedure we want to do. And if you are young and you are going for this procedure, it's causing complaint, you have to go in for the procedure. The best advice we give you is that if we take it out, you might want to consider conceiving. Because the chance it reoccurs, we might not be able to save so much of your womb.
Wow.
Aren't there womb replacement surgeries?
No, we haven't gotten there yet.
Oh.
Well, the way we can donate a heart, and no, we haven't gotten there yet.
Is it that the womb is so, delicate?
Because it has DNA structures and everything from the mother, and it's one of the few places that can take your DNA, the man's DNA, the woman's DNA, and combine it to something. And allow it to stay. It's a whole lab.
Laboratory.
Right. That's why when you talk about... incubators, your womb is an incubator. It's able to sustain life. That's why when a child is outside that incubation system, we need to put in another one, artificial one, for the child to develop well. Yeah. Especially if the child is was
premature.
Yes.
Okay. So is another option taking your eggs out?
Yes,
that's another option.
Yeah, you can.
But that's an expensive.
Yeah. You freeze it, and then maybe later in life you give it to somebody else, and somebody else carry in their womb.
Okay, but it's your DNA.
It's your DNA.
Okay.
So for those who have these sorts of issues and they cannot carry babies, their option is surrogacy.
Yes, to get a surrogate. Yeah, surrogacy or adoption.
Yeah. Okay. Yeah. You see, there's a thing that they say that the older you get, the more you menstruate, then the weaker your eggs.
The quality.
Eggs, the less potent.
The quality reduces. Yes.
Your eggs become. So that's the reason you're advised to give birth early.
So
you also don't have control over your body, and
but you just have a greater chance.
Time takes a toll. Time takes a toll on everything.
Because the more you menstruate,
do you know how many eggs are produced, and do you know how many are released?
The more quality.
You know what the body does? It produces so many eggs, right, for fertilization, right? But it chooses the most viable.
Okay.
100% quality, the purest quality. That's the one that descends for fertilization. When fertilization doesn't,
and that number is different in every woman.
It's the same in everyone. It's everyone.
No, how many is produced? How many is like very potent, as we're talking about?
I'm trying to say that it produces about thousands of them, and out of that thousands of them, it takes the best.
Because I've heard instances where a woman
is what comes out every month.
That's the one that comes out. The rest are reabsorbed and destroyed.
I've heard an instance where they say you had one abortion, you can't have babies again.
Oh no, that person is talking about the lining of the womb.
That has nothing to do with the eggs.
No, that's nothing to do with the eggs. He's talking about lining of the womb. No, that's something I should talk about. It's good. You brought it that way. Now, during the reason why those times was like that was this. There was this tool they use for trying to reach the fetus and bring it out. That tool,
DNC.
Dilatation and curettage. So it dilates the womb and then you create curettage to scrape. It's like a spoon for a watermelon. The way you go through with a spoon, right? That's what they are doing. They are removing the wall. So and this wall layer has villi. You've eaten towel before, my dear. You see that villi, like a sponge, that filamental structure on the meat, right? The intestine. The same thing in the womb. And this is what interlocks with the child and creates that umbilical cord, that feed. So imagine the child's trying to attach the wall, like those things in space movies where it's trying to attach to the space station. But the place is so smooth because you've scraped off.
Forcing it out.
Yeah, so you can't attach. Then it scrapes off, then you have a miscarriage. So your age you are looking at, that 35, you're looking at for viability. 35. If that person started earlier, it means, let's say, if you are talking about by the time of 40, your extra finished, blah, 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 that person's number will reduce to maybe 37 or 36. Whereas somebody started later on can push even further from 40.
And most of those eggs now will be Arsenal fans.
Burn! That's a burn.
What sort of job is that? There'll be Man U fans.
All the strong ones are
Man U fans.
They run the race.
The first ones
they run the race, but they'll never get there.
The summary of the conversation is that no matter when you started,
it will finish one day.
Yes, the earlier on
you do it, the better.
Because for the medical viability of both sperm and egg, earlier on is better. We are also not perfect.
Doc, just mind sharing with us the process of what we just witnessed.
So this situation, the incision was made peri-umbilical, like below the umbilicus. We call it another way for it is called a bikini line, because we try to hide it there. So when you want to be in the pool, you don't have people asking questions. Right now, so the incision is made through the layers of the skin, like we discussed last time, and the child is delivered. Now, this is done under anesthesia, so the woman doesn't feel pain, but she's awake. So we set a screen between us and the patient. So the patient dies. So we have maybe the husband or a partner having a conversation with her and keeping her alert and awake, which also help us know whatever is going on, because she's behind the screen, we're also behind her side. So somebody is there making sure she's fine. Now, for you to do a CS, right now we have something called elective CS. You can choose. Years ago, we only did it for complications. When something the child is, so you can do a CS when the child is really big. The mother can deliver vaginal, like you can have tears. Some mothers know about this. If the child is big, it's multiple gestation, like multiple children, like babies, we do a CS. Also, if there's fibroid obstructing the pathway, so we can have the piece is the mother giving us power to push, then the passenger, which is the child or the baby, and then the pathway, which is the birth canal, vaginal canal. If there's some obstruction there, we need to bypass it, so we do the CS. If the child is in distress, we do a CS. So these are interventions that are done to save the child's life and the mother's life, right? Sometimes you can have a child distress because the umbilical cord is tied around the child's neck. We need to go in quickly and get it out. If the child is coming with breech, sometimes the child will come with the buttocks. Some will come with their leg.
Wait, that's what?
Yeah, that's a breech bed. Some children.
You don't know how you keep man.
You're supposed to come with your head.
You should ask how. Yeah, it's my academy. You should ask how we came.
Yeah, you're supposed to come with the head, like the way a child came. Even when they say, see how he had already turned. So when they cut, he came with the head. Right? Sometimes you can cut and the child's leg is oncoming, which means you have to take it out if it's CS. But imagine vaginally, the child come with their feet. And you see the problem is shoulders of a child. The head is fine, but the shoulder. So sometimes you can do a vaginal.
I'm sure that
you can have a child with a vaginal coming out with a vaginal delivery, and maybe the vaginal canal is not enough. So we do an incision. We cut. The midwife or the doctor will make an incision to widen the vaginal canal so the child come out. We'll stitch it later. So it's called an episiotomy.
Stitched maybe vagina or something. Right?
Yeah, and we cut it from the base part towards the anus, but not to the anus.
Okay.
Down.
Yeah, downwards. Yeah, so to create more space for the child to come out.
For the young mothers out there watching us, what were some of your cravings? When you were probably in that situation or that state, you might share that with us on our socials as well.
Pizza and palm nose for some people.
Yeah, pizza and palm nuts.
Pizza what? And palm nose.
Yeah,
I've heard of Gobe at 12 midnight.
We'd love to hear you on jump on our socials. Freemusic.tv.
Like, I don't know if some people intentionally.
I had a client who wanted soakings.
Yeah,
Gary soakings, like granite, the plain one, no milk, with ice cubes in it. I was like,
oh, I had a friend who her cravings during her pregnancy was just momoni and Kobe. Just that. So, anything.
It's weird. Some can't eat, some can eat white.
She needs.
With this one, she couldn't eat white, anything white. So like looking white, like rice, like.
I think the algorithm of the body is
different. So you can't use yours. You can't be a mother and use yours.
Yeah, it's alterated at the point. Literally, like it's taking the body a while to figure out a lot of things happening. Yeah, some components may be aware of what is happening, but other components might take a while for it to just figure it out.
And guess who finds out first?
What?
The brain.
The brain finds out first.
So
then it's not to send signals and tell
the moods and
the mood swings and all that. So it's the brain that is trying to.
Doc, why do women also have mood swings during menstrual?
It's hormonal. Pregnancy is hormonal.
What was the hormone telling them?
So it's not the mood swing is not. You said it yourself that it's optimum. They are trying to stabilize something. So it's a titration. The hormones is titrating to find the best one. What are you saying?
I don't want peace.
Always.
I really want to understand that how the hormone affects brain thinking process.
Some do really well.
Yeah.
Some are matured about it.
Why are you defending the space?
Well, I'm only saying.
Some avoid. Some intentionally avoid confrontation.
Yeah.
Knowing where they are at, that's what they tell you. It's fine. And they start walking away.
And some women have just 1 week out of the whole month to feel
normal.
themselves.
Yeah, it's serious.
So
1 week out of the month to feel normal.
Yeah.
So the rest of the 3 weeks.
They are
on a whole management course. They're on a whole management course. Ovulating.
Wow.
Yeah. And they really can't balance.
Yeah.
Doesn't that tell us the importance of the biological role of the female? That is so powerful that it supersedes every other aspect of life.
Yeah.
It does.
The givers of life.
It does.
On that note, I think, Lenny, you should buy us all lunch.
Oh, yeah. God gives life.
As a man, what am I buying other men's lunch?
I beg you, correct it.
I want to correct something. We have the holders of life, the nurturers of life, and the givers of life.
Look, our time is up. I was asking you to wrap us up with how the sealing is done after the process. Is it immediate? They just how?
Yeah, immediately. We stitch it layer by layer, and then when we get to the last part, right now we've advanced in technology that our stitching is sealable. We use a sealable material, so you just see a thin line. To those who want to give birth, and to those who are pregnant, and to those who have undergone, who have fibroids, please speak to your caregivers. Have a conversation with them. Ask them the pertinent questions. Sit in the office there with them. Don't just come in there, do your test, get a folders and walk out. Ask the questions you need to ask. You've paid them for their service. We are there to answer the question. Most of them just come, they listen to what we say. Don't ask. We ask. Do you have a question? They don't ask us. And then they go and do whatever they like. Ask us. We are there to answer the question. If we don't know, we'll call our bosses. You understand? So please ask us what you need to know, because it's your body, it's your life, but we treat it together.